ACCESS-AP is a case crossover study designed to inform tailored interventions to prevent disease progression in acute pancreatitis. This is a collaborative study between Cedars-Sinai, University of Pittsburgh Medical Center, VA Los Angeles, Ohio State University, and Alcohol Research Group. Alcohol consumption is the most common etiology for recurrent acute pancreatitis and chronic pancreatitis, but most patients find it hard to abstain from alcohol. And clinicians need guidance for targeted and customizable recommendations regarding alcohol intake. The main objectives of this study is to determine the effective hazard period of drinking prior to an attack of alcohol-associated acute pancreatitis or recurrent acute pancreatitis. And secondly, is to evaluate the dose-response relationship between short-term excess drinking and acute pancreatitis or recurrent acute pancreatitis. A total of 160 participants will complete this study between the ages of 18 and 75 years. They have to have a Lana classification of acute pancreatitis and also meet a tweak alcohol consumption score of 3 or higher. This study will follow a case crossover observational study design in which each individual serves as his own control. We will collect alcohol exposure information in the 7 days prior to an attack of acute pancreatitis, representing the case period. We will also collect alcohol consumption levels the week prior to that as the retrospective control period. And we will also collect alcohol consumption information from a prospective control period in which they're not experiencing any pancreas-related symptoms. In addition, we will also collect lifetime history of smoking and alcohol consumption levels and quality of life information. We will collect clinical data on severity of alcoholic pancreatitis as well as complications from pancreatitis. We will collect blood and urine at the time of hospitalization, and also, again, during their standard of care follow-up when they have already resolved their symptoms. A total of 7 patients have been enrolled to date, and this study started in June of 2020. Median age is 33, and 4 have been female. 4 are African American, and most patients have reported consuming alcohol within the 48-hour period prior to the onset of pain. The median number of drinks among 7 patients is 20 drinks in that 48-hour period, and most patients have also reported drinking in the comparable 48-hour period the week prior, with a median consumption of 13 drinks. This figure shows the variation in alcohol consumption in the 15 days, including the day of the onset of pain, leading up to pancreatitis. As you can see, there is much interpersonal variation on alcohol consumption levels, as well as intrapersonal variation in the days leading up to the onset of pain. On the day of pain, there's remarkable reduction in alcohol consumption, but on the day prior, there is increased consumption of alcohol in some patients. Stay tuned in the next 2 years for a progress on results of this study. Thank you.